going to start with just a little bit of a discussion about the problems. But before we do that, let's talk about the goals. And it's very curious to me that both presidential candidates talk about these goals. And I'm very grateful for that, because I think what it does is it helps us understand that we now have consensus on the definition of the problem, which is a huge step forward. Basically, what we're looking at is a system that guarantees access, maintains choice and high quality, and reduces cost. But to do that, we've got to first understand a little bit of the problem. Everybody knows somebody here, and I maybe just ask, does anybody know anybody that doesn't have health insurance? Okay, has anybody ever had a fight with an insurance company over a health insurance bill? Has anybody paid way too much for health care or for a health care bill? All right, good. All right, wonderful. So we all know there's a problem out there. Part of the problem is that more and more people are not covered by their employer, and I don't have too many slides here, but this is one of them that shows that fewer and fewer jobs come with health care benefits, and Wisconsin is right now right about at the national average. This is where a lot of people find themselves. We all have a problem, because most of us that do have health insurance that's tied to our jobs are one bad day away from losing our health insurance. And the guy at the top kind of reminds me of a guy who used to work for a radio station and lost his job quickly and now doesn't have health insurance. This is a slide that shows how many people, how people are paying much more out of pocket than they used to. I know you can't really read the numbers up there, but we've basically gone from about $1,500 to $3,000 out of pocket in about 7 years. So we're all paying too much. And as you can see by this slide, we're paying about twice of what other developed countries are paying. Most other developed countries pay in their total health care bill what we pay in just the public sector. And when you include public employees, about 60% of all the health care dollars are paid for by public employees. So if we're paying so much money, we must have really good health care, right? Well, we don't really have the best health care, the best health. And here's a slide that shows a little bit about prevention. This was 10 years ago where the United States was ranked on, and now you can see how the United States is actually falling behind other countries in terms of preventable diseases. This is a slide that shows you a lot of people would die if we spent more money on prevention. Fewer people would die. 100,000 fewer people would die. So how do we fix this? And this is really the heart of the presentation. I believe there is a solution. It's difficult. And if it was easy, we would have done it a long time ago. But there is a solution, and we're coming closer and closer together to finding that solution. First of all, to understand the problem, we have to understand what causes high costs. When we look at high costs, some of the things we can't do anything about. We can't, for example, do anything about our aging population. We can't do a lot. We can do some about technology, but not a lot. Inflation, normal inflation, is just something we have to live with. But there are other things that we can actually change. We can deal with the problem of duplication and excess paperwork. We can deal with the problem of uncoordinated care, which is costing us a great deal of money. There's a lot of inefficiencies in the healthcare system that other businesses have figured out, other industrial sectors have figured out how to change. And finally, well, there's actually two more. Provider-induced demand means doctors and hospitals that order services just because they have that machine available. And if you'd hit it one more time, Anna, we have to talk about chronic conditions. And to begin, let me talk a little bit about administrative costs. When we look at administrative costs, these are numbers based on Wisconsin. Our total cost of administration is $12.2 billion in just the state of Wisconsin. And I used to teach healthcare administrators, so I don't think healthcare administrators are doing a bad job. I think they're part of a system that has a lot of duplication and a lot of waste. And we can solve this problem. It's a completely solvable problem. Another problem we have is that we have a lot of chronic diseases. When we look at all of the costs in the United States spent on health care, about half of them are from these 5 chronic conditions. All of these chronic conditions have lifestyle component. If you'd hit it one more time, there's our source. When we look at these chronic conditions, and I know it's kind of hard to read sideways, and I couldn't quite figure out how to put those normal so you could read them across, but asthma, hypertension, diabetes, heart disease, depression, and alcohol dependence. This is a study that showed for a large number of these chronic conditions, the patient did not receive sort of the medically accepted standard of care when that patient came into the doctor's office. So for asthma, it was only 53% of the time did the patient receive the standard of care. For hypertension, it was 65%. For diabetes, which is our headline, it was only 24% of the time. And you look over at alcohol dependence, and it was only 10% of the time did the patient receive what the accepted medical standard was. Now, a lot of doctors say, oh, we don't want to move towards these standards of care because this is kind of cookbook medicine, and medicine is an art. But I would say, when we look at 5 conditions causing 50% of the costs, we don't need an algorithm for treating every single kind of disease, but we definitely need one for treating these chronic conditions that have very, very strong lifestyle components. Chronic conditions can be managed, but only if somebody has access to medical care. One of the problems that we'll talk about a little bit is what happens when we try and keep people out of medical care. Studies show, for example, that 70% of second heart attacks can be prevented. Studies also show that 50% of initial onset adult diabetes can be prevented in at-risk. Pull it out? Yeah. Why is my earrings rubbing against it? Ah. Okay. This is very...
There we go. I'm sorry. Try that.
Like that?
Is that better?
Just one earring.
There.
You didn't warn me about the earrings.
I'm sorry, I didn't know.
Okay. Oh, now I lost it all together. You still can hear it. It's kind of weird, isn't it? I know. It's just super sensitive. Pardon me? I could. It's just hard to keep me in one place. Can I take it off its stand? Okay, we'll do that. All right, we can do that. Sorry for the technical difficulties. There you go. And turn it on. It's on. All right, this is much better. I like this a lot better. Can I put my earrings back in now? Okay, see the little guy? He doesn't like to hear anything that the doctor has to say to him. But that doctor is critical to that patient changing his care. How many people here work in healthcare? Okay, so you all know how important that patient education is and that behavior changes and how difficult it is to do this and how absolutely impossible it is to change some health habits if you don't have a strong doctor-patient relationship. Now, I want to talk just a bit about something called consumer-driven healthcare. And when I'm thinking about this, mostly I'm thinking about health savings accounts, which actually a lot of businesses I talk to are going to. Very many businesses are finding that health savings accounts are a way to initially cut costs for their business. And I say initially. I just talked with a business yesterday in Durant, and he went to a health savings account and found the second year, not the third or the fourth or the fifth year, the second year, his premiums went up 24%. So what I will tell you is health savings accounts may save you money initially if you're a business person, but you have to be very careful because until we deal with the underlying cost drivers in the system, until we deal with those reasons why costs are so high, you're still going to see huge increases in premiums, even if, albeit a smaller amount of your percent of payroll. Why? This is why. Healthcare costs are concentrated among very few people. 20% of the population is responsible for 80% of the healthcare costs. If you look at this slide over to the right, costs of greater than $3,200 per year is what makes up 80% of the total cost in our healthcare system. If you had a health savings account and had a $2,500 deductible and you happened to end up in the emergency department and then end up in intensive care for some chronic condition, you would blow through your health savings account like that. When you look at the RAND study, once people are in the hospital, coinsurance makes no difference in the cost of their care. And finally, we've got to change around the incentives on our healthcare system because frequently doctors and hospitals have a financial incentive to increase the services under what we call the fee-for-service payment system. And then the little slide over on the lower right-hand side says when you look at who is driving up healthcare costs, there are people like me. I have asthma. People with chronic conditions are taking up more than 80% of all of the dollars with chronic conditions. So how to solve this problem? There's three different aspects of the problem: access, cost, and quality. And the solution has to include all three aspects. And I'm talking about a few of the ideas on either side, and I'm going to go into a little more detail on them. But I just want to make sure that you understand what the ideas are that we're talking about. Efficiency, avoiding waste and duplication are things that we can do with, for example, electronic medical records, streamlining billing forms, changing the whole way that we pay for health care in terms of the billing processes and the payment mechanisms. Chronic disease management is something that we talk about when we're trying to control chronic diseases. High-quality medical care. We know evidence-based medicine is when you look at medical practice and you say that these physicians are going to practice based on the practices that we know work best for a particular disease, that science has told us, for example, when a patient has a heart attack, that patient needs to have aspirin. Very simple, very inexpensive, very effective. That's an example of evidence-based medicine. Centers for excellence are when people go to one particular center that's known, for example, for diabetes care or for cancer care. And quality standards are what medical staff organizations do all the time when they say, this is the way we treat asthma in our clinic. Okay. Every single part of the healthcare system has to be involved in the change. And I frequently think of healthcare. I think of the story of the blind man in India who met an elephant, and he grabbed a hold of the trunk of the elephant, and he said, oh, that elephant, it feels like a hose. And another blind man grabbed the tail and said, oh, that elephant feels like a rope. And another blind man stepped forward and felt nothing but the side of the elephant and said, oh, that elephant feels like a wall. And that's healthcare reform, ladies and gentlemen. Depending on where you sit, the problem looks completely different and the solution looks different. The only way we're going to solve the problem is if we look at every aspect of the healthcare system. Here's an example of where we need to go in terms of change. And I don't have time to go into all the details, but it is in your PowerPoint, and I'd love to talk about it in more detail. But when we share the responsibilities, we all share the benefits. So how do we get there? What do we do? Well, I'm going to talk about both of the presidential candidates and then some plans that are at the state level. Senator Obama's plan is kind of an idea that says if you have your own insurance and you like that insurance, you can stay with that insurance. But if you don't have insurance or you're having difficulty with insurance, you can buy insurance through something he calls an exchange. He talks about chronic disease management. He talks about not turning anyone away. One of the ideas he says is for those people without an insurance, we need a competing public plan. We also, as I mentioned earlier, need something called an exchange, which is very similar to the concept that we talked about in the state senate called the Healthy Wisconsin Authority. Requiring employees to pay or play. This is an idea that says either you buy insurance for your own employees or you pay into a fund and allow them to buy it for themselves. And finally, he says every family must cover their children, and if you're going to have what we call a mandate, you have to make sure that that care is affordable, and he talks about that. And finally, he said we need to allow the states to experiment. McCain's plan talks about families being in charge of their own health care dollars, and families should be able to purchase health insurance nationwide, not across state lines. And he repeats this several different times. Every family will have a direct refundable tax credit of $2,500 for an individual, $5,000 for a family, and people would be able to choose the insurance provider that suits them best. I'm not going to go into too much detail on this because we're going to hear a little bit more from some of the people from McCain's campaign. But here's a couple of ideas that he talks about. Allowing people to buy insurance nationwide, allowing the insurance companies to not comply with the state regulations, and allowing a tax credit to buy in the individual market. Both Obama and McCain talk about a lot of the same ideas, which is really a good step forward because it means that these are the components, ladies and gentlemen, of health care reform. This is what we're going to see in any plan that comes out that's very serious, if it's a very serious plan about looking at the whole comprehensive nature of health care reform. This is what the components need to look like. These are also the components of the plan that we took to put together in the state senate known as Healthy Wisconsin, where everybody was covered regardless of their health or the job. Everybody paid in. We used the payment of 10%, 10.5% for the employer and 4% for the employee, and we completely did away with the way that insurance is bought now. So that it was, the system was completely changed as far as changing the way we pay for health care. Here's a few of the details related to the benefits of the Healthy Wisconsin plan that we had as a state plan. This is a plan that would bring health insurance that's the same that I have as a state legislator to every person in the state of Wisconsin. And I maybe say something about the end. Mental health being treated as physical health was actually just passed at the federal level. So that's something new that we're going to be learning a lot more about. Governor Doyle also has a plan that's likely to end up in the budget that he's probably going to propose in February when the state budget comes out. I kind of think of it as a small version of Healthy Wisconsin. It looks at just the small businesses over 99. And if you did buy insurance, you would buy insurance through something that he calls Badger Choice. It's basically businesses choose from a wide variety of plans, but those plans play by rules. And this gives you a graph of the current insurance market in the state of Wisconsin, and he would be looking at that gray area, which is a small group market. I want to go through this kind of quickly because I know we're running out of time, but basically all but McCain's plans share a common theme, which is an idea that's known as a connector, or it's known as an exchange. It's basically that people have a choice to buy insurance, but those providers that are providing insurance play by certain rules. So the government sets the rules, and the providers play by the rules. And here's some of the rules that we're suggesting. Okay. This is an idea that came from Alan Enthoven, who's a former professor at Stanford. It's actually an idea that's been around for a very long time. I studied it when I was in grad school in the early 80s. The idea that all of these plans follow, theoretical idea, is something called managed competition. So what's standing in the way? Well, unfortunately, we've made healthcare way too political. This is a direct mail piece that just came out recently. It's completely false. I could go into all the details of why it's false. Maybe you could give us here's another example of another direct mail piece that's completely false. The problem with these is they take us away from solving the problem. They give us more of the political struggle, which is not going to solve the problem. Instead, maybe you could go one more, Hannah. We need to think about what kind of choices we're going to make in order to resolve this problem. One of the choices, Hannah, okay, you just kind of go through these quick. There you go. One of the choices, which most of us agree on, is that everybody needs health care. Many of us agree that employers should pay something. We have to talk about how much that is, what government's role is, should government be the one that sets the rules, and finally, to go back to our direct mail pieces, are we going to let fear stand in the way of action? When we look at untangling healthcare reform, remember, states are moving much faster than Wisconsin. Other states and even other cities have gone much farther than we have in Wisconsin. And we're now, I would say, 80 to 90% in agreement on the policy. And if you compare what McCain and what Obama are talking about, there are so many similarities that it helps people understand that we really are coming very close to a solution. But I do believe change is going to happen in Washington, D.C. after it happens here at the state level. Change is likely to happen, no matter who becomes president, much faster at the state level. And this is Vinehout, Senator Vinehout's looking into the crystal ball. When are we going to have change? People say, I want to sign up for that Healthy Wisconsin plan. Where is it? How come it's not here yet? First of all, we have to remember that the status quo is no longer an option. Healthcare costs are hurting every aspect of our economy. Finally, then we need to look at healthcare as the whole, not just the parts. Hannah, go one more time. We have to put aside partisan infighting, and we have to work together. It kind of sounds a little bit like kindergarten. And we can get this problem solved, and it's really up to all of us to participate in the social change that needs to happen to push Madison and Washington to get the problem solved. If you go one more time, there's a few suggestions on what you can do to help. Thank you very much.
My name's Brian Westrate. I'm a lifelong resident of Eau Claire, Wisconsin. Myself, my wife, my daughter, and my as of yet unborn son were all born at Sacred Heart Hospital. I'm a member of the executive committee of the Republican Party of Eau Claire County. I'm currently serving as the McCain campaign Eau Claire County chair. I'm a small business owner. I have 12 employees that I do not provide health care to. More importantly, I'm a husband and I'm a father. Anyone who understands the entire healthcare system, please raise your hand. From top to bottom, every part of it. Sir, I don't believe you. All right. I don't, okay? I don't have a master's degree in training healthcare people. I have an undergraduate degree in business. So I got a C- in advanced public speaking, so please be patient with me here. I may not be able to answer your questions as you ask them. There's a time-tested practice with politicians that says if you can't answer the question that's asked, answer a question, or if you don't know the answer to a question that's asked, answer a question you know. I'm not going to do that for you tonight. I researched the McCain-Palin plan. I didn't research Healthy Wisconsin, although I'd have something to say about that if I thought that's what this was about. I just researched the McCain-Palin plan, so that's what I intend to talk about. All right, Jerry. Tonight, I just want to clearly outline the basics of the plan and then illustrate the key difference, in my opinion, between the McCain-Palin plan and the Obama-Biden plan. Jerry? John McCain and Sarah Palin believe the key to healthcare reform is to restore control to the patients themselves. First part is making health insurance innovative, portable, and affordable. Making it easier to obtain insurance. An important part of his plan is to use competition to improve the quality of health insurance with greater variety to match people's needs, lower prices, and increase portability. Make it easier for both individuals and families to obtain insurance. A recent study showed that simply allowing Americans to purchase across state lines would reduce the number of uninsured by almost 12 million. American families should be given more choices by allowing them to purchase policies across these state lines. Now, while still having the option of employer-based coverage, every family will receive a direct refundable tax credit, effectively health care cash, of $2,500 for individuals and $5,000 for families, to offset the cost of purchasing your own insurance. Families will be able to choose the insurance provider that suits them best, and the money would be sent directly to the insurance provider. Those obtaining innovative insurance that cost less than the credit can then deposit the remainder in an expanded health savings account. You know, when my wife and I made the decision to have her stay home to take care of our daughter during the day, not only did we cut our income in half, but we also lost her insurance as a teacher with the Eau Claire School District. I'm not even touching anything. I remember how we analyzed costs associated with her plan versus private plans. Is there any way to just turn it off? Yes, yeah, sorry, my fault. I took it out right after college and haven't put it back in. Remember how we analyzed costs associated with her plan versus the costs of private plans. Even though the costs associated with her group plan were phenomenally higher than a private plan, it would have been nice to have the option to have taken it with us. Under the McCain-Palin plan, you will have that option. When families are informed about medical choices, they are more capable of making their own decisions and often decide against unnecessary options. Health savings accounts, or HSAs, take an important step in the direction of putting families in charge of what they pay for. My family is on a high-deductible HSA plan. As I said, I have a small business. I can't afford insurance for myself or as a group with my employees. Under our old expensive group plan, we had no idea what care was costing us. And we didn't know what it was costing, more importantly, the taxpayers of Eau Claire. Because of who we are, we didn't make frivolous trips to the doctor, but we could have. Now we shop for our care. We know what it costs us. It's made us much more informed and much more involved consumers of our health care. Before our daughter was born, we were still on the old plan. We had the 3D ultrasound. Okay? For our son, under our own plan, we shopped around. I know how much each provider charges for an ultrasound. And guess what? We got a 2D ultrasound this time around. And it didn't cost the taxpayers of Eau Claire any money. You pay for it either way, but when you actually have to write the check, you're going to pay more attention. Because realize, people, government has no means of production. If it gives you money, it's first got to take it from either you or someone else. Okay, so you're going to pay for it either way. With an extended HSA plan with choice, you're the one that decides where it goes. It's like the kid who buys a bike with his own money, takes care of it a lot better than if somebody gives it to him. Okay, part 2, Jerry. A specific plan of action, ensuring care for higher risk patients. John McCain understands, all right, Jerry. John McCain understands that those without prior group coverage and those with pre-existing conditions have the most difficulty on the individual market, and we need to make sure they get the high quality coverage they need. His plan does that. As President, John McCain will work with governors to develop a best practice model that states can follow, a guaranteed access plan, or what's known as a GAP. That would reflect the best experience of the states to ensure these patients have access to health coverage. There would be reasonable limits on premiums, and assistance would be available for Americans below a certain income level. John McCain will work with Congress, the governors, and industry to make sure this approach is funded adequately and has the right incentives to reduce costs such as disease management, individual case management, and health and wellness programs. Part 3, a specific plan of action that's going to lower healthcare costs. First, cheaper drugs. John McCain will look to bring greater competition to our drug markets through safe reimportation of drugs and faster introduction of generic drugs. Chronic conditions account for 3/4 of the nation's annual healthcare bill. By emphasizing prevention, early intervention, healthy habits, new treatment models, new public health infrastructure, and the use of information technology, we can reduce healthcare costs. John McCain will dedicate more federal research to caring and curing chronic disease. Coordinated care offers better outcomes at lower cost, with providers collaborating to produce the best health care. We should pay a single bill for high-quality disease care, which will make every provider accountable and responsive to the patient's needs. Families place a high value on quickly getting simple care. Government should promote greater access through walk-in clinics and the sort in retail outlets. We've seen the growth of this here in Eau Claire. Dr. Drawbert has a clinic out near Oakwood Mall where he just fixes bones. Eau Claire Medical Imaging has a clinic over on Hamilton. That's where we got our ultrasound done. Okay, lower costs and access come through specialization and competition. The McCain-Palin administration will promote the rapid development of 21st century information systems and technology that allows doctors to practice across state lines. A patient's information should be secure and portable. Senator Obama also proposes for the healthcare industry to have 21st century IT solutions. The difference is that he would mandate them within an arbitrary time frame. He would demand that the industry do on an arbitrary timetable what the McCain plan will encourage them to do as it makes economic sense. We must reform the payment systems in Medicaid and Medicare to compensate providers for diagnosis, prevention, and care coordination. Medicaid and Medicare should not pay for preventable medical errors or mismanagement. Under the McCain-Palin plan, the taxpayer will not pay for mistakes that are made by the system. Most smokers would love to quit, but find it hard to do so. I have a 34-year-old brother who is going to die from smoking, without question. Okay? Working with businesses and insurance companies to promote availability, the McCain-Palin plan will improve lives and reduce chronic disease through smoking cessation programs. We have these, but more resources will go into encouraging people to stop this habit before they have become a burden on the system. Encouraging states to lower costs through flexibility. States should have the flexibility to experiment with alternative forms of access, coordinated payments per episode covered under Medicaid, use of private insurance in Medicaid, alternative insurance policies, and different licensing schemes for providers. More options, not more regulations, will lead to lower cost in care. Tort reform, this is a big one for me. We must pass medical liability reform that eliminates lawsuits directed at doctors who follow clinical guidelines and adhere to safety protocols. Every patient should have access to legal remedies in cases of medical malpractice, but that should not be an invitation to endless frivolous lawsuits. Senator Obama's plan would also reform the medical malpractice system, but he would do so by promoting antitrust laws to prevent insurers from overcharging for physicians' malpractice insurance. His answer is to blame the insurance companies who provide malpractice insurance, not the lawyers who have created the need for it. Clearly a malpractice reform strategy by the Trial Lawyers Association. Unlike both Barack Obama and Joe Biden, neither John McCain nor Sarah Palin are attorneys. They are not beholden to the powerful trial lawyers' lobby. They will work to stop ambulance chasers from getting rich at the expense of the American taxpayer. Bringing transparency to health care is another key. We must make public more information on treatment options and doctor records, and require transparency regarding medical outcomes, quality of care, costs, and prices. Please note, I'm not suggesting that the plan is saying that your information should be more public, but that the rate of failure, the cost of care, the doctor's records are what should be more public. We must also facilitate the development of national standards for measuring and recording treatments and outcomes. My father, who's in the back, is 64 years old. Sorry, Dad. As a small business owner for the bulk of his career, he was self-insured. 5 years ago, at 59, he had chest pains, and following the warnings we all hear on public access television and elsewhere, he went into the doctor. The doctor couldn't find anything wrong with him, but in what appeared to have been a CYA action, and I'm not going to tell you what that means if you don't know, the doctor put down that something may be wrong with his heart. Well, folks, something may be wrong with mine, and it may be wrong with any one of you. Okay, but by putting that on his medical record, it made his insurance premium skyrocket, because now there may be something wrong with him, which is true about all of us. Okay, we have to stop things like that. Senator McCain has fought for transparency in Washington, and Governor Palin has done so in Alaska. A McCain-Palin administration will bring their record of change to bear on transparency in the healthcare system. If you are a middle-class American today, as I am, without employer-provided health care, the McCain plan would give you a tax credit of $2,500 as an individual or $5,000 for a family to help you buy your own health insurance coverage, including across state lines. American families, not government, bureaucrats, or insurance companies, will choose the coverage that best meets their needs. You will be in charge, not someone in Washington. Barack Obama and Joe Biden have said that McCain health care tax credits to help families buy coverage, quote, will go straight to the insurance company, unquote. It was said in the vice presidential debate last week. Well, here's what they failed to mention. The credit goes to the insurance company that the American family has chosen to get coverage from, anywhere in the nation. You know, the power of choice lies with the family, not with the government bureaucrats or insurance companies. You know, the Associated Press stated, quote, of course it would go straight to the insurance company because it's meant to pay for insurance. It's like saying that money that goes to a car dealer to pay off a car is wrong. Furthermore, any additional money left over after purchasing coverage will be controlled by the family in a portable health savings account. I know this may seem redundant from earlier slides, but it's crucial that you understand this point. The money will come back to you to be used for health care, but it's your money. The McCain health plan builds on the employer-based system. It doesn't replace it. Payroll taxes will be protected from increases under the McCain plan, and importantly, younger and healthier employees will have a bigger incentive to stay with their employers because of the McCain health care tax credits. Finally, the McCain plan, through comprehensive cost containment policies, addresses the single biggest threat to employer coverage, and that's rising costs. The main difference. You undoubtedly heard a lot of similar concepts from both sides, as Kathleen so very fairly pointed out. The difference is in the details. The devil is in the details. Where Obama, Biden want to require and establish, McCain, Palin want to promote and encourage. Okay? This is an important distinction. Also, will you be in charge or will the government be in charge? Let me give you an example of the pension system. Back in the 60s when my dad started working for the National Labor Relations Board, you had a pension system that if you weren't vested after 10 years, you didn't get anything. But after 10 years, you got 20% or 60% or whatever it was of your total package. Over time, that transferred into a 401k system, where you put in money and then employers would match a certain percentage of it. But when you left the employer, you got your money. From day one that you put money into a 401k, you get your money. That's similar to what we're talking about here. It's whether or not you're going to have a plan that you control and you take with you, or a plan that is beyond your control, that you have to be in. So the truth about the Obama-Biden plan. The Obama plan will create a brand new government-run health plan at the cost of $243 billion a year. Now, to be fair, even under his own numbers at 60 to 90, it's almost identical to what Hillary proposed back in the 90s, which was $100 million by her numbers. Okay, so you can almost always double or triple those numbers. Obama's plan will harm employer coverage. The Obama plan includes a $179 billion a year employer mandate. I'm an employer. I'm a small business. Healthy Wisconsin or the Obama-Biden plan would put me out of business. I would have to fire people. I would have to cut pay. Or I'd just have to go out of business. Well, no. I'd move to Minnesota is what I'd do. The mandate requires employers to either provide meaningful coverage or pay a tax towards the government plan. It creates a clear incentive for employers to drop coverage to use the government plan. A Lewin Group study concluded that almost 52 million individuals would lose their private employer coverage. To maintain their competitive edge, other employers will follow, spelling the demise of the employer coverage system. And what we will be left with is the government system alone. Go to the DMV, folks, and see if you want them running your health care. Okay. The government-run plan will have a clear advantage over private insurance since it will be subsidized by American taxpayers. A recent analysis of both plans by the nonpartisan Cato Institute concluded that the Obama government-run plan will be able to, quote, keep its premiums artificially low since it can turn to the U.S. Treasury to cover any shortfalls, resulting in undercutting the private market. Now again, the U.S. Treasury doesn't get any money in it unless it takes it from you. According to Wall Street Journal, the goal of the Obama plan, quote, like Hillary Care in the 1990s, is to displace current private coverage and switch people to the default government option. According to an in-depth analysis done by the president of Health Policy and Strategy Associates, LLC, Robert Lazowski, the Obama Healthcare Reform Plan will greatly reduce control by the individual and transfer it to the government. According to Mr. Lazowski, quote, the Obama plan is very similar to the new Massachusetts reform plan that was first implemented a year ago. The Massachusetts plan is proving to be falling short of covering everyone for an affordable cost. Its second year costs look to be coming in 50% higher than they were projected when the plan became law in 2006. And its insurance is still unaffordable for most families making between $60,000 and $110,000 a year. To sum up that paragraph, the Massachusetts plan, which is very close to the Obama-Biden plan, is costing taxpayers 50% more than projected and still isn't covering the middle class. And that's the plan Mr. Obama wants us to go into. Let me share with you a brief email I got from a friend today when I told him I was going to be participating in this. With socialized medicine, it's like having euthanasia for everybody. My father-in-law's cousin in Sweden died from cancer because she had to wait for a mammogram and MRIs in their socialized program. Also, the hospitals will cut out physicians' assistants and nurse practitioners in other specialties, and doctors' pay will get jacked. So in conclusion, let me say this. The McCain-Palin view of healthcare reform is to build on options and choices and rely on the American people through market to create an affordable system with government encouragement. In contrast, the Obama-Biden healthcare reform plan counts on 500 elected officials in government to know what's best for you and to create an affordable plan. This is America. Our strength is our ingenuity, our ability to innovate. We have invented virtually every life-changing concept or gadget since the Gutenberg press. From airplanes to the internet, the American spirit has found solutions to the world's problems. If given the freedom to do so and the time to accomplish it, two concepts that are key in the McCain-Palin plan, the American people will create a solution to the problem of health care too. But if we allow the Obama-Biden plan to move forward, once again, the heavy hand of government will undoubtedly retard the imagination of the American people, and we will continue to live with a broken system of health care. Thank you.
I have quite a stack of questions here. I can guarantee you I will not get to all of them. So please, if I don't get to your question, take no offense, but Kathleen and Brian will stay after if you would like to approach them and get your answers from them directly. Okay, this is to Brian. Are you saying that I will get a tax credit and send that directly to health insurance? And why have governments as the middleman? $2,500 will buy 3 months of insurance. What are we to do with the other 9 months? And I need my glasses. Go right ahead.
Again, if I don't have an answer, I won't give it to you. Yes, you will get if you're an individual, you will get a $2,500 tax credit. And yes, as I understand it, that will go to whichever insurance company you have chosen to go to. But here's the key. And the McCain plan is not going to be 3 months anymore. It'll be much closer to 6 or 9 or maybe even a year. Okay, the whole point of the plan is to reduce costs. Okay, one of the things my mom asked me is, how is it going to help remove 12 million uninsured off the rolls? By being able to go across state lines, because the costs will go down. Realize, people, competition decreases the cost of things. We can all hate Walmart, but the reason that your shirts are $6 a piece instead of 12 is because they came in and competed with whoever was selling shirts before. Competition brings costs down. I'm sorry, sir?
Isn't there competition now?
Certainly there is competition. Further competition, more competition, less regulation will bring costs down. We have a format here that I believe we're attempting to follow.
All right, let's go on to another one. Thank you. I'm trying to kind of make them even here. And I'm not exactly sure what, but I'll just go to this one. How are we going to pay for the mandated coverage under the Wisconsin plan? Are you really going to turn away illegal aliens and people from surrounding states when they show up to our clinics? If not, are we really covering them as well?
Okay, let's talk about illegal aliens. It's the first thing on everybody's mind when they think of health care reform. This is one of the great fallacies of Healthy Wisconsin, and I'm not sure why it's the best thing to talk about, because all I can think of is that it poll tests at 84%, and that's why people want to talk about illegal aliens. Healthy Wisconsin does not anywhere in the legislation mention the word illegal aliens. It's simply not a part of the plan. It's completely an invented issue. We have hordes and hordes and hordes of gay, illegal, pregnant aliens coming across from Minnesota, from Michigan, and from Illinois if Healthy Wisconsin passes. That's the criticism we hear. But the truth of the matter is, all of those other states have the same kind of safety net as we do here in the state of Wisconsin. If you don't have a job, and you're pregnant, and you come to Wisconsin, you're going to be eligible for a public program. The same public program that we have in Illinois, and in Michigan, and in Minnesota. It's called Medicaid. That's the safety net is still in place under a Healthy Wisconsin plan. With Healthy Wisconsin, we are changing the way we pay for health care. So rather than paying more, we're paying less. But you're not paying under an insurance plan, you're paying through a payroll deduction that goes to the Healthy Wisconsin Authority. The entire payment system is changed. What do we know? We know that we can cover every single person in the state of Wisconsin that does not have insurance and bring costs down with administrative savings alone, bring costs down by $1 billion. We know there's an incredible amount of waste in this system, and we know we're spending way too much on healthcare. And Brian and I both agree, if we change the system, we can cover everybody in the system, and we make costs affordable for everybody. He would say cover everybody, but he'd say make costs affordable for everybody in it. But we need to tackle the reason why costs are rising so fast.
Okay, Brian, this is directed to you. Who decides what is a preventable problem that your plan is not going to pay for?
I don't believe that the McCain plan says it won't pay for preventable problems. I think there may be a misunderstanding here. That what the plan is talking about is decreasing the cost of preventable problems. So if somebody's overweight, get them into a gym. If somebody's a smoker, get them on a smoking cessation program. If someone's an alcoholic, get them into a 10-step program. Okay, if someone is an asthmatic, catch it early and get them onto an inhaler, get them onto a program to decrease the effects of that particular ailment. That's, I don't believe, nothing I read anywhere suggested that the McCain-Palin plan would not pay for preventable
Yeah, I can address
issues.
that just a little bit. The Centers for Medicare and Medicaid,
Ma'am, who are you?
just passed something that defined 10 preventable errors that
What's
they
going
no
on?
longer pay for.
I think we need to stick with the question.
Oh, I just read the newspaper. My name's Liz Spencer. Sure. I mean, it's just, this was in the newspaper. It was in the news.
How about if we go through some of these questions, and maybe if people are interested, they could speak with you after, just because I'd like to keep control a little bit of the questions. But thank you. Were you done, Brian?
Yes.
Okay. This question, whoever would like to answer it. Why are insurance companies necessary? Can't we pool everyone's payment into one fund and bypass insurance companies entirely?
Why can't we? Well, because some significant portion of the 47 million Americans without insurance have chosen not to buy it. They've chosen not to put their money into health care. They've chosen to take the risk. That's what insurance is a gamble. You willing to make the gamble or not? Okay, and additionally, one of the reasons that I don't agree with, okay, I lost 30 pounds recently. My insurance is going to go down in January of 2009 because I lost 30 pounds a year ago and I kept it off. I don't smoke. I don't drink. Why should I, as a healthy American, be put into the same pool and have to pay the same rates and take the same risk for those people that do participate in those things? I'm not talking about asthmatics. I'm not talking about people that have those issues that cannot be controlled. But why should you, as somebody that chooses to become a healthy American, pay for those people that choose not to be? This is America. If you take my money and give it to someone else, that's called theft, even if you do it with government power.
I'd like to respond to the question in a minute. What I envision that the person is suggesting is to say that let us take the money that we're spending on healthcare and pay providers directly through some kind of pool, very large pool. You still have to have some type of an entity to manage the claims because providers would have to get doctors and hospitals, they'd have to get payment, and we'd have to figure out how they got payment. But the question brings up an interesting idea, which is where is the waste in the system that we need to look at to change? And we know from insurance company actuarial studies that we're looking at about 12% of the cost for all of administration is with the insurance company themselves. And then another somewhere around 20% or 18% is coming from the insurance companies requiring certain activities by the providers. And an example would be the Toma Memorial Hospital administrator told me a story about how he had an insurance company that routinely required that he submit a claim 4 times. And he figured this out by actually submitting the claim and getting rejected. Every single time he submitted the claim, he was charged a fee. And when he paid that fee 4 times, on the 4th time, that claim was paid. Now that's an example of waste and duplication in the system that you and I don't even see because we don't even know that that transaction is going back and forth between the insurance companies and the providers. That's an example specifically of the kind of waste and inefficiency that I'm talking about that can be completely changed if we change the way we pay for health care. The question then becomes, it's the question I raised, how much do we want government to pay a role? There's certainly a continuum. You can go from the United Kingdom's situation where government actually runs the hospitals and doctors are paid salaries, or you can go to the American system where it's completely private, and we actually have a system here in Wisconsin where the individual market, the market Senator McCain wants to grow, is one of the most lax in the country. So you have the problems with pre-existing conditions. So the question is, what is the role that government should play? What I'm suggesting, similar to what Obama is suggesting, is that we have government set the rules. So example, you can't deny somebody pre-existing conditions. You have to guarantee that they're going to get covered. But then the companies, and I'm thinking about large companies, whether they be provider-driven like Luther, Middleford, or Sacred Heart, or commercial carriers like United, compete. They're private companies, but they compete on a playing field, like the soccer side. They compete to provide care. Now, one idea is to have in that competition a public plan. So the public plan competes with the private plan. They're all playing by the same rules. So this goes back to the slide of the questions. What exactly do we want the role of government to be? This is a decision of the people. This is a forum for inviting people to give ideas on how we want this system to be organized. There are a lot of ideas out there. And like we talked about Massachusetts, other states are moving faster than we are, experimenting with that idea of government setting the rules and the plans competing.
Kathleen, thank you. We do have another question here on the same topic. Preventive medicine is cost-effective health care. How are individuals going to be informed on the importance of spending their money on things such as flu shots or paying for medication that could lower blood pressure? And both of you may want to address this. And try 2 minutes, please. Keep it short.
Healthcare reform in 2 minutes or less. I'll do my best.
It's tricky.
The answer is we have to align the incentives between the providers and the patients so that the providers get wealthy when the patient stays healthy. Again, it means changing the stream of dollars so that that provider is paid for likely on an episode of care or for a particular patient rather than the current system, which is every time I'm the doctor, every time I see the patient and provide another service, I send a bill, and then where's your dad? That Medicare only pays, what, $7 out of $40 of that bill. That's the problem. That's one of the fundamental problems with the healthcare system right now. The incentives between the provider are not aligned with the patient staying healthy. If the provider made money when the patient stayed healthy, we would change the way the system works. And I'd love to tell you more details if I had more than 2 minutes.
Brian?
I cross my arms not to block my body language. I fell out of a tree stand, and because I have private health insurance, I didn't go to the doctor, so it's just comfortable that way. Briefly, let me tell you about, anybody know about Community Health Partnership here in Eau Claire?
Sure.
Okay, my mother-in-law works over there as a supervisor. Here we have a private organization that is taking Medicaid, Medicare dollars and providing better service to the customer with less money. That's a private solution to a public problem. What a fabulous idea. Take the government's dollars and use it better than, oh, guess what, the government can. Okay, so I don't know if that really answers the question, but it's something to think about. Okay, it's something that's working. It's a plan that's working. It's a system that's working. So I don't honestly even remember what was the question.
It was about preventative care.
Oh, preventative care. I mean, and that's an example, I think, of, I mean, and I don't necessarily disagree with Kathleen. You know, get the provider to have a benefit if they encourage preventative care, and they'll encourage preventative care.
This one is for you, Brian. Under the McCain, or maybe you too. Under the McCain-Palin plan, would it allow young, healthy individuals and families to take their pool of savings to the new job? If yes, does that really tie them to the former employer?
The pool of savings belongs to you. I mean, the tax credit belongs to you. $2,500 as an individual or $5,000 as a family belongs to you. You take that, you buy the health insurance you want. Doesn't matter who you work for. You work for McDonald's one day and Arby's the next, and you still have the same insurer, you still have the same health savings account.
Whoever wrote that question was very astute. They were really thinking about how we're going to solve that problem. The idea is exactly the same as Healthy Wisconsin. It's the same as what Obama is talking about. It's the same as what McCain is talking about. It's something called portability. You choose the plan rather than your provider. We're talking about exactly the same thing, ladies and gentlemen. Once we get away from the government-run, the socialized medicine, the illegal immigrants, all those poll-tested pretty words that are talking points for people, once we get away from those words, we have similarities that have never come this close before in a political debate on health insurance.
This one is for you, Kathleen. With 750,000 Britons awaiting admission to National Health Service and 800,000 Canadians on waiting lists for medical procedures, why would you want to support Obama's mandating employers to provide health insurance or be taxed for some?
I love these questions. Thank you to whoever sent this question. What this shows is the incredible ignorance about one particular type of plan and the American plan that we're talking about.
Have you seen the socialized?
Yes, socialized medicine. I love socialized medicine, right?
Yeah.
We've been accusing reformers of socialized medicine since 1906, ladies and gentlemen. Can we please get off the talking points and start talking about real change? This only takes us away from the discussion of what we need to do. Britain is the largest employer in the the healthcare system in the United Kingdom is the largest employer in Britain. I am not talking about making doctors and hospitals public entities. No one is talking about making doctors and hospitals public entities. That only takes us away from the real discussion we have to have. We are this close around this country when we look at the commonalities in health policy, whether you're talking about Republican Governor Schwarzenegger, Republican Romney in Massachusetts, or whether you're talking about Hillary Clinton or Barack Obama. We are this close in solving this problem. We know from 30 years of health services research, we know what works. Let's start talking about the solutions.
Okay.
Can you talk, or are you gonna?
Briefly.
See, I got cut off right away. What about cutting that guy off?
We have one more question.
Yeah, I mean, just briefly, there is a sizable contingent of people who have read the plans who would, I don't disagree we need to find solutions. The one thing everyone agrees on is the system is broken, okay? I fell out of a tree stand, people, and didn't go to the doctor. 10 feet, I fell onto a metal tree stand. The system's broken. There's no denying that, okay? But the problem is, there are those, if you look at the history of certain sides of the aisle, it strongly suggests that the ultimate goal is socialized medicine. And while healthcare may be the #1 employer in England, it's also the #1 employer in America. You know who #2 is? The United States government. Okay? And I'm sorry, okay, people in Madison mean well. People in Washington, D.C. mean well. I do not question the hearts of the men and women who legislate us. What I question is their ability to know what's best for Brian Westrate at 212 Larchmont Road in Eau Claire, Wisconsin. Let me make my own choice. I don't need Kathleen's help in deciding how to take care of my health care.
Brian, I'm not going to choose your plan. Under any of the plans we talked about, you choose your plan, not me.
Healthy Wisconsin, at any rate, that's the problem. Okay, the question is slippery slope. When is the last time the government gave up some power and took away? Anybody got an answer?
We wouldn't be in the financial crisis if the government had kept some power over them.
As you can tell, this is a subject that's very near and dear to everybody's heart. There's lots of emotion to it. Our goal tonight was just to try to open up the discussion. There is a website for both the McCain-Palin and the Obama plan. Please go to it, learn more. I'm sorry we didn't get to as many questions as all of us would like to get to, but I'd like to thank Kathleen and thank Brian and thank all of you for coming because time is so valuable and we certainly appreciate that you know what an important topic is.